So we're at the Youth Advocacy Conference here in Croke Park, and as part of that we're launching the Headspace Toolkit, which is for children and young people who will be inpatients or are inpatients in CAMHS units throughout Ireland. So the Headspace Toolkit is important because first of all it was co-produced with young people. So young people took a strong role in developing this document so that other young people who are in hospital at any time will have information to hand that will help them have a better experience in hospital, understand where they are and how they can be best supported.
We're delighted to be here today presenting the Mental Health Commission's Headspace Toolkit. We're delighted to be partnering with YAP today and participating in their conference in Croke Park to launch the new Headspace. The Headspace Toolkit primarily does two things. First of all, it provides practical information to the young person about what's going to happen if they have to access mental health services, including if they have to go into an inpatient mental health service. Secondly, it also provides tools and strategies and information about how the young person can self-advocate and speak up for themselves and make sure that their voice is heard and that their voice is listened to in important decisions about their care and treatment in a mental health service.
So YAP's involvement has been directly with the young people. Myself and the other independent advocates meet with young people in inpatient settings weekly. We got their feedback on what they needed included, what types of information they wanted and what the detail would look like, colours, designs, that kind of thing that they would like to see. I think it will be very useful. The toolkit gives young people a chance to write down their thoughts and feelings about situations, which is helpful when speaking to someone might not always be appropriate for that young person. They might not feel safe to do so. It can be really hard to remember things you want to say, so being able to write it down, bring that into a meeting which you hand it to a staff member can be really helpful for young people to get their voice heard and get their thoughts and opinions across to healthcare providers.
It's a fantastic initiative. The toolkit has been upgraded by listening to children's voices, by listening to children's suggestions, finding out what children found were problematic with the last toolkit or the last version of it, and really making sure that children who come into a very difficult situation when they've got mental health difficulties going into an inpatient unit will now have a toolkit and a work program that will allow them to have their voices heard at the multidisciplinary team setting. In situations where they're unsure about their medication, they can ask questions, they're told how to make complaints. So what you're doing is you're empowering the young person as they come into a new and difficult situation to be themselves and to ask questions. And that's a really positive step forward for children in mental health situations.